My name is Dr. J. Michael Bostwick. I'm professor of psychiatry here at the Mayo Clinic in Rochester, Minnesota. The title of my paper is Blurred Boundaries, the Therapeutics and Politics of Medical Marijuana. This article will be appearing in the February 2012 issue of Mayo Clinic Proceedings. My goal in writing this article was to try to reconcile two seemingly polar opposites: the use of marijuana for medical purposes and the use of marijuana for recreational purposes. What I quickly discovered was that the boundary is very, very fuzzy between the two, and that the state of research is also very, very fuzzy. The reality is that marijuana has been used for almost 5,000 years, both medically and recreationally, so there's nothing new about it. It's also true that in the U.S. it was on the national formulary for 100 years until about 1942. Between 1942 and 1970, it became more and more problematic from the point of view of the federal government until 1970, when it was made a Class 1 substance, which means that it has no medical value at all and is simply a dangerous drug. This is fascinating to me because at that point, 1970, we knew very little about the endocannabinoid system in the body on which marijuana works. We knew very little about the receptors, of which there are two. And all this research to clarify this system, which is as important as the opiate system in the body, happened over the next 25 years with no change in the stance of the federal government towards marijuana. In the 90s, California, followed by, at this point, I believe 16 states, legalized marijuana's use. However, the state laws are in direct opposition to the federal law, which sets up all kinds of really problematic things. From a scientific point of view, the biggest problem is that the federal government has made it essentially impossible for research to occur in the U.S. And this is especially sad because the basic science discoveries that have found the endocannabinoid system and the receptors can't be translated into potential clinical implications, which could affect everything from psychiatric drugs to gastrointestinal drugs. So we're kind of at a standstill. Now, right now, at this moment, in fact, the federal government and the state of California are upping the ante in terms of this discrepancy in the laws. The federal government has been conducting raids in California, and California is a state in which the use of medical marijuana is entrenched. Now, that is a state as well where there's a lot of discussion about whether the use of medical marijuana is actually giving people drugs for fun. Which brings us back to the title of the article and the purpose of the article, which is the issue of blurring of boundaries and how do we sort that out so that we can get the most benefit from something which potentially could revolutionize therapeutics. Well, I believe it relates to clinical practice in more than one way. Practically, given that patients seek care outside of states in which they reside, we now have patients who are showing up in states where the medicine is illegal and they're taking it. Additionally, in states where it is legal, there's a struggle to figure out how to use it legitimately for medical problems, which can include everything from chronic pain to wasting disease with AIDS or with cancer. From another therapeutic point of view, the fact that there has not been the possibility of fully developing the potential for this drug in the lab means that we cannot see if we can develop agents that would be very helpful in multiple different organ systems and in multiple different specialties. It means different things for different patients. From the point of view of patients who have problems that could benefit from medications that were derived from marijuana, it means they're not getting those medications. It also means that if they are using marijuana, they're using it in a crude form, that is smoked marijuana, which actually contains many cannabinoids, and we really don't understand very well how they all interact and whether there are other active agents besides tetrahydrocannabinol. Another pair of important findings for marijuana and its use, or non-use is this. For people who have experience with using it recreationally, it often works very well for them when they're medically ill. So a baby boomer who experimented with marijuana in the 70s or the 60s and now has cancer might very well be able to use it and not be bothered by the psychoactive effects. People who've never had any exposure to the medication, or to the recreational use of the drug, find those side effects to be noxious. So you have an interesting situation where the psychoactivity which people seek to get high may be problematic and unpleasant in a medical setting. From a psychiatric point of view, the situation is also rather complicated because there's good evidence that while it does not cause psychotic illness such as schizophrenia, it does cause it to perhaps appear earlier in individuals who are susceptible, and in those who continue to use it, the course of their psychotic illness is rougher and more difficult, both for them and for their families.